Welcome to DBC Diaries episode 57. Today we're with returning patient Daniel. He's been here before. In fact, I think episode 27 or somewhere in there was also him. And he's back again this time to do his neck, which has really been hurting him. It's one of the few things we haven't treated with him. In the past, we had done his knees. In fact, we did his knees 2 different times. The first time he had such great success, but it wasn't quite 100%, so we did it again. And now with the consultation this time, we actually decided not to do his knees because they look so good. We fully regenerated all the problems there. So it's awesome, incredible to see. With his lower back, he's also treated that, and you'll hear him explain how he went from debilitating pain, changing his whole life to where he has no pain there. And this is a guy that served 10 years in the military. He does all kinds of long distance running. I mean, he's hard on his body and he's had tremendous results. So just so glad he could share that with all of you. So stay tuned, see what it's like to be a patient at Dream Body Clinic and how well the stem cells can work for lower back pain, for knees, for the neck. You're gonna see it all here. I'm Josh, happy to help.
Now it's time to pick up Daniel from the airport. We're happy to do another episode with him.
DBC Diaries Day 1. Today is arrival day. Daniel knows exactly where to go. He's been here before, but when you come out of baggage claim, you're gonna go outside of the doors to outside of the airport. You'll see our driver. He'll be there with a sign in his hand with the DBC logo, and he will take you to your hotel or accommodations. Very simple, and the rest of the day is just to rest and relax. DBC Diaries Day 2. So today is blood work, and then in this case, we did the MRIs in the afternoon. We try to do them back to back, but we have such a busy schedule, sometimes that's not possible. So we had Daniel come in, we took care of the blood work, all the analysis, and then had him come back in the afternoon for the MRIs. Now we have an open MRI machine, makes it very easy and comfortable for patients. I mean, it's still not the most fun thing, but we have to do these scans. You know, we don't want to guess. We want to make sure we've got all the right data, and every MRI machine is set up a bit different. The cut, meaning the different scenes that you see inside of the joint, are set to different specifications, and ours are looking for what we can heal with stem cells, not what we can operate on. So it's a bit of a different process. Better radiologists looking for what we can heal or not heal with stem cells versus what we can cut into with surgery. So we get all that done, then we take Daniel back to his hotel so he can relax, rest, enjoy the beach for the day. DBC Diaries Day 3. Today's consultation day. You'll see here Daniel talking with Dr. Barba, going over everything, going over his past scans, how he was then, how he is now. It's really cool to see, and that's one of the great things at being a patient here at Dream Body Clinic. You can always compare your old MRIs and scans to the new ones, and that's why we do it for everyone, so they have that. Daniel's case, it was good to go, so we got everything going, and then we went up with our admin team, took care of payment for treatment the next day.
Welcome again. Well, you know the process. This consultation is, the intention of this consultation is to explain you your blood work and to show you like the pictures. But you know the process, I need to do some questions first. So now tell me about the symptoms. I'm going to start with the neck.
Neck has been problematic for years, but it's been getting a little bit worse to where when I lay flat on my back, my right arm will either go numb or it'll burn. So I know that it's starting to pinch. The last MRI I had a couple of years ago, there's a little narrowing in the canal, and the vertebrae were collapsed a little bit due to desiccation of the disc. So I know it's pinching the nerve. It's just starting to get a little bit worse. But since the lower back did so well, I'm doing this now.
Do you have numbing or tingling?
Not now, but if I lay flat on my back, I do. So sitting in the MRI was interesting.
And tell me, you need to take medicine to relieve the pain in your neck?
I try to avoid medicine at all costs. I do not take it.
The strength in your hands, in your arms, it's normal.
Yeah, I work out on the days I don't run. I lift and everything. I do make sure I do like carries to make sure my grip strength is strong, so it's not being affected. But when there is a pinching in it, there is no strength, and I can't feel it.
And now tell me about your lower back.
It's doing incredible. It just has some mild pain in it every once in a while, but I run a lot. I work out, so I don't think it's anything bad. We treated it twice,
Yeah.
so I think it should be fine. I'm sure. You'll let me know. That's why we did the MRI.
Yeah.
But, yeah, it feels fantastic. I cannot explain the difference from the first time to now. It's life changing.
Right. Have you ever tried another treatment or just a stem cell for your lower back?
I did chiropractor, the stems thing, like did exercises, I did all kinds of things. And the first MRI I got, every disc in my lower back was bulging. I spent 10 years in the military. So I put a lot of wear and tear on my body, and I had several injuries. So it was chronic.
Right. The knees.
Knees are doing amazing. Same thing. Spent a lot of time in the military, bunch of injuries. The first time I got them done, very inflamed, hurt a lot, and got them done, and they felt great. And then she said she thought there was a slight tear in one of them last time I was here, so we did them again, and they feel great. I run over 50 miles a week, and as long as I do the strengthening exercises, they're fine.
Okay.
But I just wanted to make sure everything was fine in them. Because literally I have no pain. Zero.
We did 2 treatments, right?
2. Yeah. Yeah, they feel incredible. I can't believe it.
So I'm going to start with the blood work. Here we have the red cells. The hemoglobin is the most important marker, and it's perfect. Then we have your immune system, your total leukocytes that are in range. The optimal range for adults is between 4 to 10. Okay? The problem is when this number is higher than 10, because that means like you can have an infection or something. Platelets in the lowest limit, but still in range, 120 to 500 is the optimal. So I think it's fine. And here we test your glucose or blood sugar, and it's perfect. We test your kidney function, it's perfect. Uric acid, perfect. Total cholesterol, it's really good.
Really?
Yeah.
That's great. I've been working on that.
175, it's
The last 2 times I was here, my LDL was a little high, so my range is up a little bit.
So this is your total, and it's amazing. Your triglycerides, really good. Your good cholesterol, it's almost perfect. Like it's in good range, but the optimal is 60 or higher.
Yep.
53, good. Your bad cholesterol, the optimal here is less than 100, so
that's great.
this
So
is
it's going down.
almost normal.
Yeah.
We test also your liver function, and it's perfect. Proteins in your blood, perfect. This is a really good news. Your PSA for prostate cancer, 0.6. This is amazing. We have your thyroid function. It's perfect. Estrogen levels, good. Testosterone in range, 367. And testosterone, free testosterone, it's in range.
Not bad for 53, huh?
It's amazing. This is your neck. We have the cervical spine, we have a front view, and we have a side view. I'm going to start with the front view. The most important here is to find if you don't have any scoliosis or some abnormal curvature. In your case, looks fine. We don't have that problem. But we can see in these pictures some dehydrate disc or some like degeneration, right? That it's almost normal, like aging or wear and tear. Then we have the side view. On the side view, we can see bulgings or impingement,
Yes.
right? So we have bulging disc in different levels, but to confirm or to know if this is a real problem, we have this view. In this view, we can see the disc. Let me make this bigger. We have the disc and we have the spinal cord. If you can see here, we don't have any compression. We don't have compression. We can see here like a bulging, but it's not like pushing into the spinal cord, like so. It's fine. We have a little bit of compression. It's a little bit more on the left side. And this is C2, C3, C4, and C5. So between C4 and C5 is where we have a little bit of stenosis or some compression in your spinal cord. And here again, we have some compression. Same thing, more on the left side. So we have two levels with major problems or with more compression. So I think with the stem cells, we can treat this problem. We can help to improve the nerve issues, and we can help to relieve the compression in your spinal cord. So we have two different levels. So remember 2, 3, 4, 5, 6, and 7. So this is your cervical spine. So my suggestion is to do like an injection in the lowest part of the cervical spine and in this area, C3 and C4. Okay? Sorry, C4 and C5. So C7, 6, so 25 million combined with the stem cells and another injection here, 25 and 25. So we use 100 million for the cervical spine. Do you have questions about your neck?
No.
Then we have your lower back.
It's better great because it feels incredible.
So same thing. We don't have any scoliosis on the front view. L5, 4, 3, 2, and 1. So this is your lower back. If you can see, we just have like almost nothing here and here, right? The quality of the disc is not the best, but it's, to be honest, I think it's good. Something important is here, we normally have a curvature. The name is lordosis. In your case, it's more straight than normal. Some physical therapy or exercises can help you to improve that position. If you can see here, we have this curvature. In your case, it's straight. To confirm, we have the other view.
That's awesome. I mean, that's great.
The spinal cord in these levels looks different than the cervical spine because here we have the last part of the spinal cord, right? This is bone. This is the disc. We have a little bit of compression between L1 and L2, but it's not like really bad. Then we have L2 and L3. Looks better. We can still see like the root of the nerves. We can see the spinal cord. We don't have any compression. The anatomy or the shape of the disc, it's fine.
It feels great.
So we have a little bit of compression on the center.
Good. 53.
And L5 and S1, the most common place to have a bulging disc, like, looks fine.
That's great.
So I think in general, your lower back looks
Amazing. Hello, man.
Yeah, I think in your lower back, it's now not necessary to do like another treatment. So we can wait probably like 2 or 3 years to do maintenance.
Yeah, and I'm going to come back in another 6 months anyways because I want to make sure we're checking everything out. So I'll be back again. You guys know that.
So questions?
No, very happy. Very, very happy.
On the first MRI, the report says like arthritis in 3rd degree was really bad. Like, we was having like a lot of inflammation, white in this area. Now, the arthritis looks almost nothing behind the kneecap. And inside the joint, we can see like the difference between bone and bone. So that is good. We have enough cartilage. We don't have like too much inflammation. So this is probably
Feel amazing.
almost normal or 1st degree of arthritis.
Yeah, I cannot express in words how amazingly good my knees feel. It's just
And well, meniscus, they normally look like a black triangles, like here on the side view where you can see the meniscus. We still have like a small lesion in their meniscus, but the cartilage looks amazing. So now I don't think it's necessary to do a canal treatment in your knee.
yeah. So January is my peak running season. I do a 5K, a 10K, a half marathon, a full marathon in January. On the Thursday, Friday, Saturday, and Sunday. So after that, I'm going to come back. So I'm going to come back in January or February. We'll check them out.
To see what happened.
Yeah. I do it every year.
So now we have the left knee. Same thing. We have the kneecap here. Then if we go to the inside, meniscus, we can see the difference between bone and bone. So it's the same. And the first time, I think it was 3rd degree of arthritis, closer to the replacement. Now, and this is really good for somebody who runs like 40 to 50 miles every year. On the side view, look, all the cartilage.
I love that.
Looks really good.
Muscles don't look fatty either.
Like muscles looks really good. PCL, ACL,
That's incredible.
same thing. We still have a small lesion in your meniscus, but I don't really think it's necessary to do another treatment.
Yeah, we'll be back in January.
So
I love it.
yeah, like I think we'll have to treat your neck
Yeah.
and the IV.
Yeah.
And facial treatment, right?
Yeah. So 100 million comes with when you do the neck. I want to add another 100 million.
Okay, so 200 million,
for the IV. Yeah.
100 on the neck, and 20 million on the
Yeah.
right. So
I love it. Yeah. Awesome.
do you have questions?
No, very happy.
Great.
Very happy.
So, well, your treatment is going to be tomorrow.
Very, very happy. Thank you.
You're welcome. Like,
You got a patient for life. I keep getting everything fixed until I can't fix anything else.
if you don't have questions, then we need to go for the next part.
It's great. I love it. Thank you so much.
You're welcome.
Very happy. Very happy.
Nice to see you, and well, to see this kind of
You
improvement.
will see me again in 6 pets too.
At this moment, I'm going to take blood sample for Daniel to obtain the PRP. These are important for his next treatment.
DBC Diaries day 4. Today's treatment day. So Daniel comes in. He's going to get any last questions answered by the doc, and we're going to get to it. Start doing the injections, doing the treatments. It's a very simple process. It's very anticlimactic. The injections typically don't really hurt, very quick. You know, you're not here a lot of time. The doctors make it as easy as possible. So once that's done, we're going to get Daniel back to his hotel where he can relax. And we always recommend just kind of chilling out, taking the day easy, no jumping in pools or in the ocean the day of treatment. We want to just avoid any risks with any sort of infection when needles are involved. And once that's done, he's just going to enjoy the day. DBC Diaries day 5. So today's the last day. We want to thank Daniel so much for coming, for sharing his experiences. You know, he's been here quite a few times, and luckily every time he's had just better and better results. So, you know, we're hoping he doesn't have to come back anymore in the future, but if he does hurt something else, we're here. And that's how we help a lot of people. You know, we're always hoping that our treatments are one and done, but in some cases they take more than one attempt to get them all away, but almost always see at least some improvement. So if you'd like to learn more, get a hold of us. Check out the website at www.dreambody.clinic. Scroll down on the homepage. You can click any of the treatments are listed there. They've got info, prices, links to studies, or you can call us toll free at 888-704-3977. I'm Josh, happy to help.